the next panel for the New York State Health Foundation webinar. Really appreciative to be able to connect with everyone. Would like to take a few minutes to introduce my guests, myself, and the topic that we're going to be discussing. First, I'd like to introduce a member of the New York Governor's Challenge Identifying and Screening Priority Group, Michelle Cleary, a behavioral health and addiction prevention advocate. Michelle is the Senior Program Associate 2 with Advocates for Human Potential Incorporated. Michelle, good morning.
Good morning.
Next, I'd like to introduce Dr. Joe Geraci, representing New York Governor's Challenge Connectedness and Care Transitions Working Group. Dr. Geraci is the co-director of the Transitioning Service Member and Veteran Suicide Prevention Center with the VA Vision 2 MyRec. Dr. Geraci, good morning.
Morning, sir.
And then finally, I'd like to introduce Dr. Marianne Goodman, a member of the New York Governor's Challenge Lethal Means and Safety Planning Work Group. Dr. Goodman is the Associate Director of the VA Vision 2 MyRec. Dr. Goodman, good morning.
Good morning.
So thank you again for everybody joining us. My name is Duane France, and I'm the co-director of the Servicemember Veteran and Military Family Technical Assistance Center. In that role, I co-lead a team that provides technical assistance to communities and states around the country, implementing suicide prevention and behavioral health integration program for service members, veterans, and their families. Starting at the community level, the Mayor's Challenge to prevent veteran suicide in 2019, the VA SAMHSA Governor's Challenge to prevent veteran suicide was launched. The goal of the program is to support the implementation of the public health approach that we've been talking about this morning for the prevention of suicide in the military affiliated population. These efforts help states and communities develop the capacity to implement interagency action plans grounded in evidence-based suicide prevention practices. So we're going to be having a conversation today talking about the work that New York has been doing since becoming part of the Governor's Challenge. Feel free to ask questions in the chat. My colleague, Ben Berriman, will be monitoring the feed and answering any questions that you might have or passing questions on to the panelists. So I'd like to start off our conversation with a bit of history around New York's involvement in the Governor's Challenge work. Starting in March of 2020, the state of New York was one of 20 states to participate in the second cohort of the VA SAMHSA Governor's Challenge, a partnership between stakeholders across the state as well as federal partners. I'd like to hear from each of you how the Governor's Challenge work began from your perspective and how it's evolved over the past couple of years. Dr. Goodman, we'll start off with you.
Great. Hi, good morning. I'm very excited to join you all and tell you about our New York Governor's Challenge Lethal Means Subgroup Project, Lethal Means Safety and Family. As Dr. Matt Miller stressed in his keynote, suicide prevention includes all of us, and this project brings family and loved ones into the fold. Our group includes suicide prevention community partners across the state, including Gara Lloyd Lester from the Suicide Prevention Center of New York, Dr. Stephanie Gamble and Deb Krasta from the Center of Excellence for Suicide Prevention in Canandaigua, Dr. Rob Lane and Emily Mitchell from the VA Vision 2 MyRec, where I am as well, and Jason Skinner from the Livingston County Veteran Service Director. Plus, we have project consultants Kathy Barber and Elaine Frank. They are famous from the CALM training, the Counseling for Lethal Means. They're the ones that helped develop that. Our project is graciously funded by the New York Foundation as well. So here's the backstory. 17 veterans die by suicide every day. 12 out of 17 use firearms. That's about 4,400 veteran suicide deaths every year from firearms, and about 62,000 firearm suicide deaths from 2005 to 2019. And that's 15 times the number of soldiers that were killed during Afghanistan, Iraq, and Syria engagements. So we know that firearms are lethal. They lead to death in about 85% of suicide attempts, whereas other methods like overdose, it's much lower, about 5%. We know that veteran gun ownership is about 45%, and this is twice as high as civilian gun ownership, which is about 20%. There's been considerable efforts in the past few years to promote firearm safety and lethal means counseling, but this has been directed at clinicians as well as ER personnel, and it's been very, very helpful. But there's no lethal means safety instruction that's directed specifically to family, and that's surprising given that the important role that family members play in reducing suicide risk, and that's where our project comes in.
No, I really appreciate that. And as we've been hearing all morning, this is a significant aspect of service member, veteran, and military family suicide. So I'm really grateful to hear that New York has really taken the charge to address firearms and lethal means safety. And we'll talk a little bit more about some of the specific projects coming up. Dr. Geraci, you are part of another priority area of the Governor's Challenge on the New York team, really supporting connectedness and care transitions.
Yes, sir. And I think, kind of where the work started, I think it's kind of important to go back, as I would say, even though I'm serving as a clinical psychologist within the VA and co-direct with Marianne on our transitioning service member suicide prevention work. But I would definitely say I am a soldier for life, and 20 years as an infantry officer, 4 deployments to Afghanistan. It's just, as much as I try, I just cannot get that out of my DNA. It is part of everything I do. The way that I see the world, the way that I smell the world, is through an infantryman's perspective. And if you look at combat armed service members, my brothers and sisters, literally and figuratively, some of my service members that are transitioning, I was definitely kind of drawn back and to look at the extensively high rates of suicide for service members within the first 3 years that are 18 to 34 years old. And that's like 75% of the service members that transition every year, all 200,000 of them are within that age demographic, 18 to 34-year-olds. And if you look at their rates back in 2001, pre 9/11, right about 22 per 100,000 is how we measure suicide and progress and rates. And then, this last report, it's over 45 per 100,000. So in spite of the great work, and I share to some extent Dr. Matt Miller's, hope and optimism about this, but I'm also seeing that this is a population that's really, really struggling. And, we look at some of the limitations of the evidence-based practices. We look at the reticence for service members to acknowledge suicide risk. So really wanted to step back and really say, like, how do we look at this perspective from the service member's perspective? What do they want? What do they need? And how do we deliver that in a scientific, evaluation specific realm? So that's what we did, a randomized controlled trial in New York City from 2014 to 2018 to kind of show the importance of having that Sherpa, that peer, that sponsor, that guide to help you. It's what we do in the military. Leaders manage transitions. And this is one transition where a lot of our service members are really kind of individualized out there. And we kind of talked about how Kelly talked about the negative implications of isolation. So going through transition difficulties, isolated into a community they don't understand, and absolutely preventable. Definitely hitting on some of the values of Dr. Miller. So being able to bring some of our work to the Governor's Challenge in priority area number 2 is quite an honor and privilege, working with Ben Palmer and so many different nonprofit organizations that are out there. They're doing the significant amount of work to really bring this to fruition. So thank you, sir.
I appreciate that. And there is a lot of overlap. I recognize that our 3 priority areas really allow some focused work in these areas. But again, talking about that peer-to-peer support and establishing that trust, which allows us to have those conversations, for example, about firearms or maybe about suicide risk, as we're going to talk about with Michelle here shortly. And so I think that it's really important how New York has really focused in on this area, but also understanding how it is going to be impacting the other priority areas as well. And so, Michelle, you are part of a group in New York that is really looking at identifying service members at risk and screening for suicide specifically.
Yes, and my work actually, I'll go back a little further. Beginning in 2007, actually, I was working with the Division of Veteran Services. Jim McDonough was one of the leaders who really was looking at how we're identifying and working with service members, veterans, and their families. And so fast forward to 2019, and he and I had been at the TA Center for several years, and he and I were talking about, New York being ready to come into the Governor's Challenge. The timing was right. And so really looking at who we needed to get around the table and what were the important issues. And one of the key issues that we'll talk about some more is that identifying a component and recognizing who among us are service members, veterans, and family members. So we'll talk more about that, but there has been a longstanding commitment from the Division of Veteran Services. And when Jim McDonough left, Benjamin took over, and we've really been able to keep a team growing and evolving and to address these issues that we needed to see happen.
No, I appreciate that. And I have a little bit of a soft spot in my heart for the New York team. And Jim's ears are going to be burning a little bit, but Jim's brother was my battalion commander when I was deployed to Iraq in 2006, 2007. And so the military is a close knit, not very small, but that kind of stuff crops up all the time. And a lot of times it's all of these different relationships connect, not just federally, but also locally and at the state level. And so when it comes to really building these suicide prevention coalitions, it's helpful to utilize a framework to organize the work. We've been talking about a little bit of these 3 priority areas: identifying service members, veterans, and their families, and screening for suicide risk, promoting connectedness and improving care transitions, and increasing lethal means safety and safety planning. Now, these priorities align with both the national strategy to prevent veteran suicide from the VA standpoint and the CDC's recommendations for effective suicide prevention. Each of you are a member of these working groups for these priority areas. I'd like to hear a little bit about the work of your priority group, going a little bit more into what has been done and what's been accomplished in your work so far. So Michelle, maybe you could start us off with some information that has been done around the identifying and screening priority group.
Sure. So as many people know, I was actually a part of the Service Members, Veterans, and their Families Technical Assistance Team prior to my joining the New York State team. And what I had seen throughout the country was and the importance of identifying veterans, but service members, veterans, and family members. And so that really became one of the cornerstones of our work group. And then the other cornerstone was the screening component. And that was certainly both Dr. Kelly Posner and Keita Franklin were the 2 people in that work group who also really spoke to that and really highlighted the importance of those 2 elements. So first, I'll start with the identifying component. What we know is that so many of us are going to cross paths with veterans, service members, veterans, and again, family members, and may not know that they served. And so I think a lot of us on this call also probably know that asking the question, are you a veteran, is often not going to be effective. So based on what we had seen throughout the country, the New York State team really said, okay, how are we going to incorporate this and how are we going to implement an approach where more people who, in a variety of roles are asking the question, have you or a member of your family or loved one ever served in the military? So, and really thinking about how we can be identifying our service members, veterans, and their family. In January of this year, based on the work that happened with our team, the governor recommended that all executive branch agencies in New York State ask the question, have you ever served in the military? And for me, it really comes down, there's a personal example that I have. My father served during peacetime, and most people would have no idea that he was a veteran. And most people would have no idea that I was a caregiver of a veteran. So when we think about it from that standpoint, and I am just one example, there's just so many examples that again, if we polled everybody in this conference, there's probably some connection to a veteran or even an active duty service member. And what are the opportunities to be making sure they're aware of the resources that are out there? Or if they're at risk for suicide, what are the questions we can be asking? So then too, thinking about the screening component, as I mentioned, going back to Jim McDonough, he worked with Dr. Kelly Posner and Keita Franklin and asked them to be on the team. And Dr. Posner is a force for really addressing suicide prevention. And she's the director of the Columbia Lighthouse Project. And Dr. Franklin was also transitioning over to the Columbia Lighthouse Project at that time as well. So really thinking about how we then help all of our entities, our state agencies in particular, disseminate the Columbia Suicide Severity Rating Scale. And I think if anybody's heard Dr. Posner talk about the Columbia scale, they know it's a easy to use scale, but there is so much evidence behind it. And so the idea was, how do we help first our state agencies, veteran service officers, and then other entities become familiar with that resource and learn how to use it and have it available at their fingertips. So one of our team's pilots is integrating the Columbia Protocol into all executive branch state agencies and all veteran service offices at this point. So I think that's everything with those were our two key elements in our work group.
I think those are really two good questions to ask. And the second one, that's necessarily the question. But I think that's a great example of how states can apply these concepts to some unique areas. You know, have you ever served? It's sort of, and we know, for example, Missouri is including that question on all of their forms, the state forms. Colorado, for example, has done that in the judicial branch specifically, or in the justice involved system. And so a number of different ways to be able to apply that. And then are you at suicide risk? So that question is not necessarily, are you a veteran? And then I'm going to immediately ask if you're at risk. Both of those questions then have to say, now what? Now what do we do? And so if, are you a veteran? Yes. Or are you a family member a veteran? Yes. Now what? If you are at risk, now what? And I think that can really lead to some next level trainings or teaching people what they have to do.
Yeah, Duane, and I'm glad you mentioned that, because you're absolutely right. Just asking the question is not going to do the trick. It has to be backed up by the resources and the network and the information that's available. So great. Thank you for reinforcing that.
Well, and I think, again, this is where we can go very, very deep, a number of different levels deep in each of these areas. And for New York to have taken on the deep work in each of these priority areas is really significant. Now, Dr. Goodman, the Lethal Means Safety and Planning Working Group has done some significant work over the past couple of years in something that I'm actually pretty excited coming out, and really excited to share with the group here today.
Great, thank you. So our work group has really focused on, project has 4 parts. The first is defining the problem with family and lethal means. The second is developing the educational product. The third will be disseminating, and the fourth will be measuring the impact. I'm going to talk to you about the first 2. So in terms of defining the problem, we conducted 30 interviews of family members of 3 groups: family members who lost a veteran to firearm suicide, family members with a veteran who had a firearm suicide attempt, and family members with veterans who had firearms in the home. We wanted to understand their experiences, gaps in their resources, wanted advice on the best training vehicle to convey information that they wish they had had. The interviews, there are many themes that emerged: difficulties in identifying suicide risk in their veterans. They weren't sure how to start conversations about firearms. They had a lack of knowledge about firearms in general. They were unclear who and how to reach out for help, unclear of safe storage options. They wanted validation about their experiences, and they wanted to hear stories from other families. So we spent the last 10 months taking these themes and developing a website and bringing video vignettes of family members about firearm safety. So Duane, I'm hoping you could show our 2 clips. These are hot off the presses, just literally from the videographer team in the last week. We've gotten them back. These are still draft versions, but I think seeing is believing, and I think it'll give you a sense of how far we've come. The first, I'm assuming you'll show Barbara first.
Yep.
This is a family member really trying to reach out for help and not sure where to go.
So the techno wizardry of sharing the first video.
This one night, I was really scared. I had never seen Mike so mad. And he had one of his guns laying right there on the table. I think this was the first time that I wasn't just scared for him. I was scared for the kids. And me too. And even after he had calmed down, I couldn't talk to him about being afraid about the guns. He says, I don't know anything about firearms and I'm just being hysterical. So I called his dad. Fred knows a bit about what's been going on with us. And I told him things are getting worse. And when he heard how much my voice was shaking, he said he'd come right over. And I'd never felt more relieved. This was not something I could deal with on my own.
So a very brief vignette, but there is a lot of power packed into that minute and 10 seconds, I think.
Yeah. And the idea there is to convey the message that you cannot handle this alone. You need to reach out for help. If you could show the next clip, that's another about a minute clip. This is the actual conversation of the father-in-law, Fred, and what it was like to actually talk about some safe storage options.
Growing up, Mikey had some down times, but this was different. And when his wife called, I got a bad feeling. So I went over there and we talked a bit, and I could tell he was hurt. And at some point I put my arm around him and said something like, Mikey, I know these are tough times, but I know they're gonna get better. But I'd feel a whole lot better if you let me babysit those guns for you. I need you to be safe. We went back and forth a bit, and he didn't like the idea of not having his guns under his roof. He's got a nice collection. Safe's heavy duty too. So what we did was, we changed the combination. Well, first I made sure all the guns were in there. The ones from his bedroom and the one from the truck. Now if he and Barb get into a big fight, he can't get to the guns. And I'm literally sleeping a lot better at night. The funny thing is, it's a lot easier to talk to Mikey now too. Just kind of let everything out in the open. So yeah, one step at a time.
Again, I think a really good bookend to see obviously how a spouse will respond to the immediate crisis, but then reaching out to someone that can be trusted and will be listened to by the veteran in crisis.
Right. So the idea is we wanted to sort of both validate the emotional concerns, but also sort of educate and give suggestions and resources. So these are just two examples. There'll be a total of 5 such videos and another 3 videos from a clinician from the VA who's also a veteran and firearm owner. So it sort of gives the gamut of different experiences.
Now, this is part of, and many people perhaps on the call are familiar with counseling on access to lethal means. So I, as a clinical mental health counselor, refer that to my colleagues all the time to be able to take that. And this is actually part of specifically counseling and access for lethal means for family members and caregivers that's really specifically addressing their needs, whereas sort of the mainstream counseling and access on lethal means is sort of derived for providers. And so this is really something that's taken what we know works in one area, but you've developed it for people that are more likely to come in contact with a veteran in crisis than us as providers, for example.
Right, and we have those the creators of Calm helping us with this project, and they've been instrumental in helping us get the right message and detail.
And so this is, it's as great as this is sort of the preview. I understand that it's due to be released in the beginning of 2022. It's
Yeah,
not quite finished yet.
Yeah, right. February 2022 is what we're aiming for. We're working with the website team now to put everything in place, but these things take a little bit of time. But we're expecting February for the launch date.
And again, I think this is a great example of having some particular expertise on the team. So the folks who were actually involved in counseling and access to lethal means as part of the New York State team, but then saying, what if we do something different? And what if we take this? Yes, it seems like 18 months is a long time, but we've been dealing with this for a number of years. And so I'm really excited. It's not just going to be a New York State resource. This is actually going to be available nationwide. Any Governor's Challenge team, anybody who is implementing these things can actually take this course and share it. And I think it's a really great example of something that'll resonate not just in New York State within your communities, but in any communities that are really dealing with this issue.
I just wanted to add, thank you for bringing that up. We are taking a lot of effort and pain here to make sure the website can be delivered to other states. So there is some specific information about gun laws for New York, which would have to be tailored for specific states. But the idea is that we want this to be disseminated beyond New York.
No, I absolutely appreciate that. I have a colleague in Florida who often says that veteran suicide is a national problem with a local solution, and those local solutions at the state and even really from community to community. And really, Dr. Geraci, going on to that local connection and even seeing some of that trust that needs to be had with these conversations, connectedness and improved care transition has proved to be an important factor that can keep someone from getting into a suicidal crisis, or if they do have a crisis, to ensure that the safeguards are in place that keep that crisis from being fatal.
Yeah, absolutely. And really want to take a moment to commend Marianne, Stephanie, some of the others on the team, Derek Coy and New York State Health Foundation's, support for those videos. And I always say a lot of times, like, while I might be a religious person, I don't interject religion, but this is beyond, this is like spiritual. This is spiritual work. Like the personalization of that human, kind of story and those videos was really profound. So thanks, Marianne and the team, kind of for that. And continuing this spiritual work is how do we really kind of all kind of come together to help others that are in dire need. Just kind of talk a little bit about, you mentioned, Duane, some of the connectedness and how important that is. As I mentioned, it's our DNA as service members, as veterans. Concepts is, kind of, battle buddies, kind of definitely resonates with that. And so my role within the VA is a researcher, evaluator, and trainer. So there's an initiative, a sponsorship initiative for transitioning service members. And I'm helping to lead with Marianne across the country, helping to identify best in practice work that's helping for service members. And one such project that we're aligned with is this, when you're in the service, you have a permanent change of station sponsor. You go from one installation to another. As I mentioned, the dearth of such leadership supports you transition out. So what would it be like, to have that sponsors you transition into the civilian sector? So one of the entities we're working with that is in a VA non-monetary partnership relationship right now is a nonprofit called ETS sponsorship, expiration term of service. When you transition out of the service with the directors, recently retired Brigadier General Mike Eastman and Bill Buck. So we did have a chance to do the randomized control trial with this concept, with this initiative. Did see some really good positive initial results, which then helped the VA to fund 2 program evaluations that we're doing, one very specific to Texas and one nationally that we're working with here within the New York in the Governor's Challenge. So after priority group number 2 decided that this is the priority project that they wanted to move forward with, and started establishing goals and SMART goals, and then kind of looking at different indicators to evaluate, joining such states as Washington, Texas, LA County with the Mayor's Challenge, Florida, New York, New Jersey, Massachusetts, and Wisconsin. With those other states, also New York wanted to really kind of bring this to fruition within the state. So one of some of the key elements of it is the evaluation component. So working with service members that are on military installations, and this is really unique, is that this is one of the first evaluations I'm aware of. We were actually evaluating a program, an intervention that begins within the military, evaluating service members. For example, give them a Columbus Suicide Severity Rating Scale, reintegration difficulty, social support, and then following them through the progression into the civilian sector within research, as we coined, Marianne, myself, and Dr. Silk and others, as the deadly gap. So how do we fill this deadly gap? Through evaluation. The numbers and the results are critical. We've got to be driven by the data. So another entity that we need to do within the governor's challenge is the now enroll service members. So one of the largest military installations active duty within VISN 2, New York, New Jersey region is Fort Drum, New York, just a little north of Syracuse. So we have an official memorandum of endorsement with the U.S. Army leadership. So we're enrolling service members at Fort Drum and helping them that are transitioning to the state and then also across the country. We're also working at Joint Base McGuire Dix Lakehurst, the Air Force, down in New Jersey, and another major installation, Fort Hood. So service members at Fort Hood coming to New York have a chance to work with the sponsor. So I think the key entity, so I'll be honest, the easiest part for us is getting service members enrolled in the program. We 20, 30 service members per day, because they'd almost expect it. They're used to having somebody guide them through the process. So it's like so many of them, like, I'm surprised there wasn't something like ETS sponsorship prior. So the biggest part for the initiative then is, how do you galvanize the community? This is the truth of community-based intervention, as Matt talked about. It really takes all of us. And I'll be honest, like, every single person on this call right now would be a phenomenal sponsor to work with a transition service member coming to your community. So we've, fortunately been able to partner with great academic institutions like Syracuse University and Fordham University, part of the Governor's Challenge. So next week, we're going to train about 300 sponsors between those two different academic institutions, virtually and also in person with our team. We've done 51 cohorts so far of sponsors. And our goal is to get to 500 total sponsors within New York State by Veterans Day, and an opportunity to really make that happen. And it's pretty profound. This universal public health approach that is driven from veteran input with evaluation, where we all can really get engaged and involved. And it's really been exciting to be part of this as it moves forward. But the key critical entity is you and the community. Raising your right hand and say, I really want to be part of the solution. And that's what this is all about. And allowing us to do the training and then to do the evaluation to show the return on investment for everybody. And then this can't be done without a digital solution really to manage this at a macro level, and then also facilitate data to be brought into the VA so we can do the evaluation and the operationalization of it. So just really thankful for all those that have been involved in the digital solution, so that service member that enrolling at Hood, Drum, Joint Base, McGuire Dix Lakehurst around the country then has a chance to be connected to the state. That state has the information all the way down to those local communities. And it's all about us all coming in together to help facilitate a successful transition for a vulnerable population that's looking to accomplish their next mission in the civilian society. So thank you, sir.
No, I really appreciate that. I think back to my own experience leaving the military. August 1st, 2014 was my first day as a veteran, because I'll never be a civilian. I drove through Fort Carson, and wouldn't you know it, the flag went up, the flag went, like the Army literally kept rolling along, right? You know, that when we were in the military, as I was transitioning, everybody I connected to, it's in the military. They didn't have any understanding of what things were like after, on the outside. We were focused on our mission. We were focused on doing what we were doing. And then you get out in the military, and all of a sudden you've got 5, 10, 15, 22 years of, I no longer do that. That can be challenging for people like me, where I had 18 months to plan and consider and think and transition out, versus you have some service members who have maybe 18 weeks or even 18 days with being out, and the less time you have to transition, the greater the risk is falling into what you would call that deadly gap.
Yeah, absolutely. And what would it be like? Let's just kind of pontificate. What would it be like if we all really kind of helped this population? So there's 200,000 service members that transition every year. Our goal is that every single one of them has a sponsor in a local community to successfully bring them home and have a welcome welcome back parade for every single one of them in their hometown. Somebody meeting them, no different than the sponsor. The most challenging transition I had, people like, you were going to Italy. How could it have been a hard transition? That's easy. So like our family, moving to Italy, to a foreign country, kind of being on that flight for many, many hours with a couple of kids under the age of 4, had no household goods, had no idea where we're going to stay. And they have like our sponsor at 2 a.m. meeting us at the airport and say, hey, we got you. We're going to get you through this. What a huge relief that was for us. So what would it be like if we recreated for all 200,000? And the answer is right on this call right here. Every single one really could kind of help to be part of this and allowing us and the VA to really kind of evaluate the implementation of it. And also really want to commend the Governor's Challenge for putting together the New York Governor's Challenge website. It really kind of captures and solidifies all this phenomenal work we're doing in one key place so that everybody can have easy access to it.
And again, how these actually integrate, right? Because you need to be able to have a sponsor that the service member or the veteran or the family member can trust to, like Michelle was talking about earlier, hey, do you need some help? Let me share some resources with you so that I know that you're a service member, or have that trusting relationship so that Dr. Goodman was talking about, that if there is a crisis, how can we have these firearms? Again, this is a great example of these are not independent. These are actually interconnected pieces to the different puzzle, which is all a part of the solution. And so I really commend that. All of us doing this work knows that it's neither easy nor finished. There's a lot of ongoing efforts that we hope will come to fruition and begin to reduce suicide in the military affiliated population. I'd like to hear from each of you what ongoing work is being done in your specific priority group that people can look forward to. Joe, we'll start with you.
So I'll just bang the drum is become a sponsor. Or also another thing we're doing aligned with our training is it's called Veteran Cultural Competence Training, evidence-based training, a day-long training that we provide. So we have, fortunately and unfortunately, so we have a pretty long wait list. So now with the capacity decision is on how do I get VA capacity. So we had about 400 people sign up for the training. We got a capacity for 300 next week. So how do we recreate that? So we did it in Texas 3 weeks ago. It was a phenomenal showing. We're going to be Washington State, Florida, continuing to do with our partners at Syracuse and Fordham. So I would say, kind of sign up. I'll put the link in for our Veteran Cultural Competence Training as one. So if for those of you that are in community want 7.5 CEs, to be able to kind of better serve service members, VA and non-VA providers or community members. We appreciate the prior support from New York State Health Foundation for that initiative. So that's one entity, is that the training initiative. The other is, I'll reiterate it again, is just help a service member transition to your county. There's a good initiative, Operation Greenlight, which the different county veteran service officers within New York, that's one of the initiatives that they're doing, so that all of the VSOs within the county level can become sponsors and access that dashboard to help service members transitioning back to their region. Because unfortunately, the states have very little heads up on who's coming to their region, unless it's a distress call, somebody's getting arrested, or there's a suicide attempt. Like, we can do better as a country to really kind of help this population. Thank you, sir.
No, I appreciate that. Now, regarding that training, right? We all know the military is as much of a culture, just like anything else. Those of us who served, we speak a foreign language called acronym, and sometimes expletive, right? We speak those fluently. We have a different way of thinking. But what is one of or who would partake in this training, the cultural competence training? Is it just clinical providers? Is it service providers? Who should consider signing up for this cultural competence training in New York?
Yeah, absolutely. And that's the exact research question that we had. So we looked at, about 500 people that we've trained over the last couple of years. And that was the question, like, who benefits most from this training? So we thought like veterans wouldn't benefit, right? But we saw that veterans had a significant increase in their ability to relate to other veterans and have really hard, difficult conversations. So we also then kind of saw that there was no differentiation between medical providers, psychologists, psychiatrists, counselors, social workers, and business leaders or government leads. So, our recommendation that if you work with veterans within any aspect of your day-to-day, kind of employment or professional career, it'd be beneficial, to kind of go through this day-long immersive training. So I always use the analogy, go back to like your high school foreign language. Nobody remembers anything unless what? You were immersed in that culture. You went to that culture and you spent time there, and you had to feel anxious about fitting in and understanding. So let us like engage you and put you in as much anxiety provoking situations as we can in one day to allow you to feel like you know what it's like to be a veteran. And the research has shown that it really kind of helps. So we've got the pre-post and day long, or the pre-post and month long. The month long really kind of seemed the stick factor. And as much as I love online training, webinars, very short, we saw very little impact. You really need to have skin in the game, immerse yourself in that culture before you're going to start to change your belief systems and your behaviors related to engaging with this population.
Yeah, no, I appreciate that. I think one of the most valuable things that I appreciate about post-military life is I don't have to go stand out in the rain for no good reason. I can actually, pop up an umbrella or go inside. But there is something to be said about standing out in the cold for no reason, apparently, for a long length of time. Not that that's what you do. Maybe that's a suggestion if a good Fort Drum winter could build some character. So Michelle, I'd like to hear about what the Identify and Screening Priority Working Group has coming up.
So our work group has evolved a little bit, and like any good action plan, you keep evolving and updating. And so our work group is starting to take shape in outreach and public information. And so what will end up happening is we're going to keep moving forward on developing a marketing and public health campaign, and then also really just trying to look for more of those partnerships. We're obviously continuing to do the training with the executive branch agencies in New York State, as well as the veteran service officers, but also looking for other opportunities for partnerships to help them recognize ways to identify. And then also thinking about the screening component and where are there opportunities. The training on the screening, the Columbia Lighthouse Project is very committed to training, and we will continue to be doing that too, and just looking for other opportunities to get that information out and help people connect to these resources.
Now, when you're talking about other organizations who may be interested in implementing something like the Ask the Question campaign, I would imagine you're thinking maybe the big social determinants of health, so like homeless veteran organizations or employment organizations, or even realtors, the local association of realtors, the bar association. And those are the kind of things you're talking about and originally what you said is you're going to come across a veteran every day and you don't know it.
Yeah, and again, I'm glad you mentioned that because we've seen states have bank tellers trained on asking the question because, and not necessarily would a bank teller know that the person standing in front of them is connected in some way to military service. So really spanning. I love that you mentioned realtors. Really thinking outside of the box. It isn't just our behavioral health bubble that so many of us work in. It's really throughout the community, those opportunities that can present themselves.
Yes, and so if you're on the call or you're watching the webinar, absolutely. If you say I'm not in behavioral health or I'm not even in social support, other states, other communities have found restaurant and bar associations, right? Because they are very much likely to come across somebody or to tell if a regular, for example, who may be having some concerns. And so I definitely recommend that you reach out to Michelle or their team to talk about, because it's one thing to say, how are we going to ask the question across the state? But it's actually, how are we going to ask the question in your community? Not just for your customers, but also for your employees. That's another big thing I think that a lot of people, we heard that before about first responders, is when you start teaching first responders how to ask the question of the people they come in contact with, well, the first responders themselves are going to reach out and identify.
Yeah, absolutely. Yeah.
So definitely recommend reaching out. If you're with an organization who could benefit from some type of support, reach out to Michelle and her team. And then finally, Dr. Goodman, we did sort of give the great news about February this year, but what other things beyond the counseling and access to lethal means for family members is the Lethal Means and Safety Planning Working Group planning for the upcoming year?
Well, we want to, once we launch in February, we want to be able to bring traffic to the site. So we're going to spend a lot of time reaching out to suicide prevention coalitions, the Tragedy Assistance Program, VA Caregivers Program, AFSP community groups, and veteran family organizations. We want to get the word out about the website. We'd also like to measure the impact. How many hits are we getting on the various videos? Are some of the videos more effective than others? But we're also very excited. We're going to be launching a next step project, which is to develop an in-person community workshop that builds on the content of the website, but gives an additional kind of person-to-person feedback, do some role plays about talking, and personalized information. So that's in the works.
Well, I really appreciate that. And again, as Joe was talking about before, yeah, consuming something, but watching a movie is very different than going to the play or even actually being in the play, right? And I think that's a very important next step component of, okay, I've received this information, but how do I apply it in a practical manner? And some of these questions, especially we know this about suicide and also talking about firearms, requires a lot of practice.
That's right. That's right.
So we do have about 5, I'm sorry, go ahead.
Oh, that's the next step. You worded it beautifully.
And so we do have about 5 minutes left. If anyone in the audience has any questions or any comments about some of this, would love to hear them. I'd like to turn it over to each of you for a couple of final thoughts on this panel or the work of the Governor's Challenge overall. Dr. Goodman?
I have to say it's been a fabulous experience working with people from across the state. I'm a VA person, but to work in the community with other partners has just really expanded the work. And I think, as you could see from this panel today, I think the New York State team has done wonderful across all 3 areas.
Absolutely. Michelle?
I have to echo Dr. Goodman. I mean, the team that has come together is just amazing. And to me, it's so heartening to see the evolution that is continuing to really make sure that our service members, veterans, and their families are supported. So it's a pleasure.
Absolutely. Dr. Geraci?
So one thing that I would really like to share is that it's been really cool to see everybody willing to jump in the same foxhole and fight the same fight, and really to kind of show the commitment of the VA to kind of solve this problem set. And there might have been other options or other academic ways that I could have engaged or committed my work, but I was like, if we're really going to be truly part of a solution that has enterprise impact, it's got to be through the VA. And so I've just been really, thankful to be work as a VA employee, but then get to know some of the great people within the state and the local communities. And another entity that's really going to be out there, the VA is funding that Matt didn't mention as much as the community engagement partnership coordinators, part of Suicide Prevention 2.0, just really reiterating the critical importance of the clinical aspect. A lot of suicide prevention coordinators, but then the community engagement partnership coordinators with the community-based intervention side, and us all really, really working together. So like, this is not, the VA of the past, if you will. This is a VA that really wants to be innovative, implement evidence-based practices to really kind of be in the same foxhole together. So it's great being in the same foxhole with you during this one.
Yes, absolutely. And as I often say, I, as a clinical mental health counselor, us in the clinical field, we don't have the answer to the solution. This is Dr. Miller's famous equation of, the clinical plus the community interventions, because if we did, the problem would be solved right now. And it does take a wide and comprehensive effort. The SMVF Technical Assistance Center is proud to be a partner for New York State. Want to congratulate all the work that each of you are doing in your groups individually and also collectively. I think it's a really great example of how other states can come together and work in a comprehensive way to be able to address some of these solutions. So thank you once again to my fellow panelists, Michelle Cleary, Dr. Joe Geraci, Dr. Marianne Goodman. Really congratulate New York on the great efforts that you have had.